I'm Katherine Clayton. I'm currently just recovering from my hip operation, which I had 8 weeks ago, and after that I intend to go working for myself, opening my own business in Lytham. For some years now I've been suffering with osteoarthritis, and as years have gone by that's become increasingly worse. 5 years ago I had a right knee replacement, but it soon became apparent I needed the hip replaced as well. So back in April I came to see Mr Dunco, who agreed that the hip was in a state of disrepair and he needed to replace it. The process to get it was something that I think needs to be worked on, if I'm very honest, simply because I was in lots of pain and I was constantly in my own GP's surgery, having to have my morphine increased. I ended up being on the highest milligram of morphine twice a day, and I was taking a bottle of Oromorph a day, and I had to really badger to be brought in. My GP was very good in that sense, and I've got to say the pre-op team, when they saw me, were quite alarmed of how bad it was, but getting me in and getting me sorted, it didn't move fast enough really to say the amount of pain I was in. I think the process that could have been improved was I could have been seen and operated on sooner, and the reason I say that is I was in hospital twice in between seeing the consultant in April and November. I'd had 14 falls and 2 of them hospitalised me, and on neither occasion were they going to do that hip. They wanted me to stay on the elective sheet simply because they said that the amount of staff and the availability would have been better for my recovery. Psychologically, absolutely horrendous, because you're in a zone and you don't know where to turn. I was phoning the hospital and trying to speak to the pre-op team to please fetch me in. They weren't doing that at the time. I had to really push to my GP, and even though I'd fallen that amount of times, it was a case of, we do know you are on the list and we will get to you. I was just in a state of, where do I turn? The operation itself went absolutely perfect. From the day I walked in to admissions, I couldn't have asked for any better service, for any better care, for any better follow-up than I had. Prior to me coming in, I wasn't even referred to the pain clinic, but as soon as I woke up from the operation, I had so many people around my bed. It was like, what was all these people doing? They were the pain team, they were the anaesthetist had stayed, and they were so concerned how they were going to deal with the pain, because there's nothing else they could give me, because I was up to the limit of painkillers and my Oromorph. But I've got to say, can't fault it in any way, shape or form, and absolutely credit to the NHS for the care after I received. It was almost like it was 2 different organisations, prior and post, and that is the thing I think is quite alarming for me. The whole team after, from the admission team that I went into on the ward, to the physios, to everybody after, has been amazing. So what stood out for me about the pain team was the fact that they were there absolutely all the way through me being in hospital and after. The nurse that came to see me, Lisa, was just absolutely outstanding. She made me feel genuinely concerned about me, and really inspired me to move on, if I'm honest with you, as did most of the team on that ward 16. The message I'd say to them is a huge well done and thank you for everything that you did after the operation. Caroline works on ward 16 and she saw me pretty much after, and because it was such a big operation and I'd had so much pain, they expected me to be quite a difficult patient, and the same day I was walking around and ready, and there's no one person I could say, because individually they were all absolutely brilliant. I couldn't single one out. Amazing, every one of them.
I am pleased to hear that Katherine's surgery was a success and that she is no longer in pain. I was sorry to hear about Katherine's preoperative experience and would like to apologise for the delay she encountered. Delays for orthopaedic surgery are due to the winter pressures we are experiencing at Blackpool Victoria Hospital. Patients on the surgical waiting list may also experience a delay if they have other medical issues which they need to be referred to ensure they are safe to have their procedure. We will not schedule in patients for surgery unless it is an emergency. This is because patients are exposed to hospital-acquired infections on the ward, and we prefer to see them after they have been discharged to allow their skin colonisation to settle down.
Hello Catherine, we have seen your video. Thank you for the lovely comments about the acute pain service. We strive to provide effective pain control for all our post-op patients. Thank you very much for the comments.